the socket is a transtibial as well as transfemoral, and both are highly successful technology which is broadly used all across the country, all across the world. As we have seen in our next previous presentation about the socket, different types of socket system, total surface bearing, PTB socket. You have seen various slides and types of socket and related issues, troubleshooting as well. In continuation of that, we are going to discuss about the direct socket DT, which is the part which you can say this is also a total surface bearing socket. That is actual TSB socket, which is made up of over the patient within limited time of period, and it is highly successful and familiar to the patient. Lot of question will come in your mind how it is possible, since we are doing the hand casting, doing a lot of pressure sensitive and all type of amputee, indoor walker, outdoor walker, the walker with the high active user with regress demand, that is K1, K2, K3 and K4 change if the principles are correct and followed by the proper way. Second, someone is highly experienced, someone is a new person, the doesn't matter here. That is also a very big deal. Patient comes to you and says that I have a very less time and all the stuffs are available in your clinic, you can deliver the case in 1 day with all trainings and everything. So no need to do the plaster casting. That is another advantage. So it's a time saving techniques, you can see. So as I said, that fabrication and delivery is one session. If everything is there, then you can deliver the patient in the same day. A standardized process. So the outcome will remain same, whosoever is making the socket, if the process is followed by proper pattern. Clean fabrication. In my when I was in doing lamination in institute, all the hands and everything becomes dirty due to the because I was new, and the same thing I hope that the same thing happened to you also if you are doing the lamination in your institute. The same problem you might have faced during the lamination, but here it is nothing. You can just follow the process. You will get very neat and clean socket, very neat and clean environment after following the procedure, after completing the procedure. Usually various suspension system, as we have seen in our next previous presentation about the different types of suspension system, that is lock suspension, vacuum suspension, lock and vacuum both, or if patient doesn't want to go for any kind of such simple socket, you can make this kind of, you can apply this technique for any kind of patient. Even this procedure, if you want to avoid modification and just want to do the straight away plaster casting, you can use this technique for plaster casting also and apply the particular vacuum as per the requirement. Negative cast, fill it, just polish it and drape the socket and deliver the patient. That is also possible in 1 day if it is required. If it is required, then. Now, what are the things is required for? What are the concept actually? So, if you are using a liner, then you cannot do the lamination just over the liner. For particular liner, we have a casting liner. Similar. Suppose you have a 25 size liner you are going to use for the patient, then you have to use 25 size casting liner. The reason, because the liner thickness is 3 mm. The proximal thickness of the liner is approximately 3 mm, 2.8, 3 mm. It may vary, but this liner is, the thickness is 1 mm. So if you are using that liner, then your socket fit will be proper. If you are making a socket over the actual liner which you are going to deliver to the patient, then you might have used some sock to compensate the volume. So the first criteria is to use casting liner for the same size. Suppose your size, casting liner size is 28, then you can use 28 size liner, casting liner. Then new materials are there. You can see the next one. There are the braids. PVF sheet is there. That is the covered, one side covered with the fabric, another side is silicone. So it's, the resin will become, will be sandwiched in between and to fabricate the socket. There are one tube, you are seeing that the resin cartridge is there, hardener and resin both. So inject with one tube, one way, and spread all across the stump and become set between 30 minutes. So we will demonstrate the procedure. The third one is the tool. This is the tool which is required for complete the process. And the final outcome, you can see the socket, that is a black one. If you want, you can use the different pigment to make, if you want to make a socket red, blue, white, whatever you want, just apply some pigment and make a socket. So it's your choice. But ideally, we are providing the black color and the skin color. So this is the casting liner. The reason behind using the casting liner is the thickness. So if you will make a liner on 1 mm thickness liner, so your outcome will be proper because you are doing some circumferential reduction in your final socket in positive mold. So in consideration of that, we are using the thin liner. Your question will be, might be there that can we make a socket on the normal liner? You can make, but to compensate the volume, if socket is loose, you have to use some sock. But again, it is not possible in terms of vacuum socket. Suppose if your socket, vacuum socket is there and socket become loose, then vacuum will not hold the socket and liner. Different sizes, it starts from 16 centimeter to 34. So as I said, your liner size is 22, you can use casting liner size 22. The rest of the thickness are same. The liner distal thickness is the same, but the proximal thickness become vary. Now I am coming to the suspension system. Again, another advantage of this liner, suppose your patient is not stable with the mind. Today he is telling I want to go with this locking liner, and tomorrow he said that I want to go for a vacuum suspension system. So it's not, means there is some investment. If you have made a socket and his mind has been changed, what you will do? This is the socket. You might have heard about the modular system. This is the modular socket. So you can change the system without changing the socket. Lock to vacuum, vacuum to lock, vacuum to cushion, whatever you want, you can change it with the minimum adjustment in the socket. So this is the biggest advantage, you can say, and I am not able to demonstrate all these 4 suspension system, but yes, there is a possibility to change the suspension mechanism if patient is insisting you to change it. Then this is a circumferential measurement, that is 4 centimeter above. So it is a standard one. So no difference. It is applicable for casting liner also. It is applicable for normal liner also. So these are the kit. So practically I will demonstrate it with the, this is the black one is the bread. It comes with the 4 layers, 6 layers. It comes in a three types, basalt, glass fiber and carbon fiber. This is the resin. It comes in 200 and 400 ml. Based on your stump length, you can use it. But in transtibial case, the ideal way of selecting the patient is between 12 centimeter to maximum 20 centimeter, not more than that. Because if you select a patient more than 20 centimeter, then your bladder will not reach up to the corneal area. It is not reach up to the mid of patella. So please try to find out the patient in that in this means 12 to 20 centimeter in between. So these are the types of braid. Glass fiber is the cheapest one and dearer than this glass fiber. But glass fiber is also equally strong because it is in 6 layers. Rest of the carbon and basalt is 4 layers. So if patient is not concerned about the weight of the socket, if the patient is not concerned about the price, then you can go for the basalt and make a good and lightweight socket. The braid comes in 4 inches, 5 inches and 7 inches based on the liner size. So it is easy to select. Suppose your liner size is 16 to 20, you can go for 4 inches. If your liner size is 23.5 to 30, then go for 5, and more than 32 and 34 is 7 inches. So again, this is also an important thing. If your braid size is not correct, then there will be a chance of getting some wrinkles over the socket, which is not cosmetically good. So please consider all these things for good fitting and good cosmetic socket. So again, 200 and 400 ml cartridge is there. So you can just use it based on the requirement. Because once you will start using this, you cannot reuse the resin which remains in your bottle. You have to throw it out. So that is also a matter of consideration because if required is 200 ml, just go with the for 200 ml. These are the different components in direct socket toolkit. So one of the most important thing is this pressure pad. So we usually give a relief over the head of fibula, distal end of tibia, or any bony prominences which is not pressure tolerant, which is pressure sensitive. Then you can keep these pads in between the liner and make the socket over there. So another thing you can do it if you want to keep this pad, just make the same kind of pad with the peddling or whatever materials are available in your clinics. Just make the same kind of pad and just fix it there. So you will get relief, you will get contact, both the things will be there. Because this pad cannot be used for the patient for delivery purpose. You have to keep it in your box for the next use. This is the bladder which apply pressure over the stump. So it is not just now I will demonstrate it and you will come to know the uses of the bladder and the pump and the injecting tool. That is the red one. So rest of the things we will discuss during practical demonstration about the material, direct socket toolkit and direct socket material kit as well. So again, these are the accessories. If it is something missing or something is spoiled, you can place the order. You can get it. So the same procedure we are going to demonstrate it now for the final outcome. As I said, it can be used for transtibial and transfemoral both, but transfemoral is not yet launched. We are going to demonstrate only transtibial now, but it is broadly used worldwide and broadly recognized successfully, you can say. And one of the one other another thing I want to say you that we have discussed, we have read it in our when reading every day that ECM, ramus, post-trochanteric pressure, and if you will go with this socket, all the things means disappear now because this is subistial socket, and subistial socket is also broadly recognized worldwide. So if you are making a socket, just you have to follow the procedure, and the most critical fitment is transfemoral fitment because hip disarticulation is also easy. Only hip joint placement is little critical. It just make a girdle sort of things. Transtibial also comparatively, but in transfemoral it is little difficult because patient has a lot of complaint about the ramus, ischium, a lot of gaps and lateral proximal gap is there. So to avoid all these things, you can follow the procedure of making a socket. You will get proper outcome and proper good fitting socket, you can say. But recently it is not available in India. So I am done with my presentation. Next is practical demonstration over the patient. If patient comes, then we will start. If you have any question, please.
Thank you, bhai.